down to the renewed hope we have for this pandemic. For those who do get their shots, there's some new recommendations from the Centers for Disease Control. Here to break down the CDC's guidelines is Associate Professor of Pharmacy Practice at Cedarville University, Dr. Jenkins. Good morning to you, Dr. Jenkins. Welcome to the National Desk. So before we get to the CDC's recommendations, what qualifies someone as fully vaccinated?
So it all comes down to about a 2-week period after the completion of a vaccine regimen for a person. So in the case of Pfizer and Moderna, after 2 weeks, you're able to get, you're considered fully vaccinated. And then in the case of Johnson & Johnson, after that single dose regimen, 2 weeks later, you're considered fully vaccinated.
Okay, so let's take a look at some of the takeaways that the CDC has released on what individuals can do if they are fully vaccinated. One, they say you can gather indoors with fully vaccinated people without wearing a mask. You can also gather indoors with unvaccinated people from one other household without masks, as long as they don't have a severe or an increased risk for severe illness. And also, number 3, they say if you have been around someone who has COVID, you do not need to get tested unless you have symptoms, which I thought was really interesting. So you no longer have to quarantine either if you were around someone who has COVID. What is your analysis of those CDC guidelines?
So really what they're telling us is, the studies have shown we're protected from severe disease and hospitalization when we do receive these vaccines. But there's some data that's starting to come out that's actually showing it does decrease transmission. And so we had some initial data in the Moderna study, and there's more data coming out of Israel and other places now that are also sharing the same thing. So it's doing what we're hoping. It's really slowing down the spread of this in the community. And these guidelines are really kind of a way of opening things up for people that have been vaccinated because of that decrease in transmission.
I was going to say that is a huge point you just made right there, because that was one of the reasons why initially they said, hey, we don't know if this is going to stop any transmission. We just know you're not going to get sick, right? We just know you're not going to be in the hospital. So that's a really good piece of information that just came out as well. Are there any precautions, though, that fully vaccinated individuals should still continue to practice, do you think?
Yeah, so when you really look at the data, we know that these vaccines do not protect everyone 100%. So part of the reason for herd immunity is, of course, that very reason. We're trying to protect those people who maybe aren't shielded. So even in this case, they're suggesting right now that we do, at least in large gatherings in big public places, try to do social distancing, try to use masks, avoid gatherings with more than one household for that reason, because A, not everyone's been vaccinated yet, and then of course B, not everyone's always insulated.
Yeah, and doctor, but still, this gives people maybe who might have been on the fence about getting vaccinated, maybe it gives them some kind of incentive, right, to perhaps get vaccinated. As an infectious disease expert, I'm just curious, what's your assessment of where we are currently when it comes to controlling this pandemic and combating the coronavirus?
Well, the good news is our cases and deaths are declining. And so that's heading in a very positive direction. If you look at a lot of states now, they're having discussions about when some of the different orders that are in place will actually be pulled back. So where I'm located in Ohio, for example, they've actually set a goal for the prevalence in Ohio. When it's at that certain level, they'll actually pull back a lot of those mandates. So what that really tells us is that we're seeing a decrease in spread in the community. And we have a lot of these solutions that are coming to the table, like vaccines, like some of our therapeutics that are helping us to better combat the virus.
Well, that sounds like good news all around, right? Dr.
Absolutely.
Jenkins, we appreciate you joining us this morning. Have a good day.
Thank you so much.